My name is Benjamin Rubin. I'm a neurosurgeon here at Colorado Brain and Spine Institute in Denver, Colorado. I specialize in complex and reconstructive disorders of the spine, as well as minimally invasive spine techniques for spine surgery. I've been in practice about 3 years here at CBSI. Today we're going to be focusing on specifically disorders of the SI joint or the sacroiliac joint. The sacroiliac joint is the joint that connects the base of the spinal column at the sacrum with the ilium, which is a major bone of the pelvis. And it is a complex joint with a lot of different movements and angles and is important for supporting our weight as we walk and move. There are a lot of conditions that can predispose somebody to having pain within the SI joint, including degenerative arthritis, abnormal motion or looseness of the joint, as well as other inflammatory disorders. The most common movements and conditions that cause patients to experience pain within their SI joint are usually mechanical. People are moving either by walking or climbing stairs. Sometimes sitting in a different position can exacerbate the problem. The current studies that we have suggest that anywhere between 15 and 25% of patients who present with low back pain may have dysfunction at the SI joint. There are multiple exam techniques that we can utilize to help differentiate SI joint pain from other problems, including manipulation of the joint itself by moving the legs in different positions or testing the pelvic structures. And when we do that, we're able to elicit that same feeling that they have here in the office. Then we have a much higher level of confidence that the pain is actually coming from the SI joint. A lot of times before we go to surgery, we want to try and maximize conservative therapies and do non-operative interventions first. So, for example, we do an anti-inflammatory injection of steroids into the joint, and some patients can get long-lasting relief with that can be anywhere from weeks to months. A lot of times patients will benefit just from plain old physical therapy. They can get in with a physical therapist who will teach them stretching regimens and help to exercise that joint and learn to use the joint in a way that doesn't hurt them or doesn't generate the pain. We do have some other minimally invasive pain management techniques like radiofrequency ablation, where we essentially burn the nerve endings that are going to the joint that send that information to the brain. So when we do the procedure, we are essentially making an incision out on the hip laterally, and then under x-ray vision placing these 3 dowels or implants into the joint space to connect these 2 bones together. And by doing that, we eliminate motion between this bone and this bone, where there normally would be motion. The beauty of the SI joint fusion procedure is that it can be done minimally invasively, and it's usually an outpatient procedure that we perform in the hospital, but the patient can go home the same day from surgery. The surgery takes anywhere from about an hour to an hour and a half. And in that time, we're able to get a total of 3 implants into the SI joint to completely fuse it and prevent any more motion. When a patient wakes up, they may have some incisional pain, but generally they feel pretty well and are able to go home the same day. So if you feel like you're experiencing SI joint pain, we encourage you to contact our office and get in for an appointment so we can evaluate you.